Methicillin-resistant Staphylococcus aureus, otherwise known as MRSA, is a bacterial disease that affects various parts of the bodies with sores, boils, or mild skin infections. By watching this video, I hope to spread the knowledge on MRSA with high hopes that it will then help decrease the spread of the disease. Lori Beinauer, mother of two, lived most of her life in a small town called Newport, Pennsylvania. Within 1 year, she went from the norm to death because of this deadly disease. It is due to this event that I feel this disease needs more attention and concentration and further studies. So what steps should we take to help prevent the spread of MRSA? By knowing these steps, we will help achieve this goal together, and we will be able to determine who needs to know this information and what message will be best used in attaining the proliferation of this message to the audience it determines. Staph infections are among the most common within American families and usually remain minor. However, there are severe forms of staph infections like MRSA which result with surgery and sometimes death. MRSA is set apart from other bacterium diseases due to the fact that MRSA is hard to treat and often resistant to antibiotics. The strain of MRSA was able to adapt and become resistant to penicillin and many other common antibiotics. Because of this resistance MRSA has to antibiotics, MRSA has the potential to spread quickly in compact communities such as hospitals, community centers, homes, schools, and gyms. MRSA is spread by skin-to-skin contact. In fact, the CDC estimates that for every 100 people, 2 carry this deadly disease on their skin or inside their nose, most likely due to the normal and transient flora that protect us. Another way of coming in contact with disease is coming into contact with an object that contains the bacterial strain. A few objects to be concerning are the following: feeding tube, catheters, gym equipment, shared textbooks, and so forth. With this information, we can then say that the people who need to know about this disease are people who work and live in compact communities. With this reasoning, that would entail most everybody within the human population. According to research, elderly patients and ill individuals are the most vulnerable to catch MRSA. This is why home care facilities and long-term residential care patients are typically the most vulnerable. However, I feel that community risk is more concerning for contracting MRSA. The most common of these areas consisted of crowded, unsanitary environments. This is where gyms, locker rooms, and physical training facilities typically come into play with this bacterium. Symptoms of MRSA consist of rash turning into a boil or abscess forming inside the body. Life-threatening symptoms involve infection in the bloodstream, joints, bones, surgical wounds, lungs, and heart valves. Since MRSA is often resistant to drugs such as antibiotics, doctors will do more than likely take a tissue sample to determine the presence of the bacterium. Doctors will always try antibiotics first, but if they are ineffective, they will have to proceed with surgery to remove the bacterium. Instead of waiting until this point, I feel it would be more effective for us to focus on the spread of how to prevent MRSA versus how to treat it. Good hygiene is essential to avoiding and contracting the disease. Washing hands often and thoroughly with soap and warm water and using sanitizers will help accomplish these goals. When injured, it is always important to properly disinfect and treat the wound quickly. Also, never share towels, clothing, and personal hygiene products with other people. By taking showers after working out, you will limit the spread of the bacterium. In fact, new research has suggested that you'll receive much more than a workout when you go to the gym. Protect yourself in the locker room by avoiding to touch as many things as possible and always wear footwear. Kids should be taught this subject in schools and regularly reminded by their guardians or parents. It is my hope that no one should ever have to go through what Lori Beinauer endured. Her arms and legs were amputated, and in the end, she died. The more people who are made aware of this disease and how to prevent it, the fewer reports and deaths will occur in our future.